June is Migraine and Headache Awareness Month, an important time to raise awareness and learn more about migraine, a debilitating neurological disease, including a recent FDA approval of an additional preventative treatment option for those living with chronic migraine. So talking a lot today, so let's welcome Dr. Hope O'Brien, neurologist, founder and CEO of Headache Center of Hope, and Kelsey Owens, a working mother living with episodic migraine. So thank you both so much for joining us, and I'm glad we're going to get both perspectives here. But Dr. O'Brien, let's start with you. What is migraine and what is the difference between episodic and chronic?
So migraine is not just a headache, but it's a complex neurological disease that affects up to 40 million patients living in the United States. It's characterized by moderate to severe head pain, typically one-sided, lasting anywhere between 4 to 72 hours. And it's associated with symptoms such as light and sound sensitivity, nausea, and vomiting. And Kelsey's here with me today. We are partnering with AbbVie, the maker of Qulipta, to raise awareness on an important milestone in migraine. And when I talk to patients in terms of their migraine frequency, one of the things I do is to try to characterize them into having either episodic migraine, meaning they're having between 0 to 14 headache days per month, or chronic migraine, meaning 15 or more headache days per month, of which 8 of those days are impacted by migraine.
Wow. Okay. Well, Kelsey, let's move it over to you. Excuse me. How has this impacted your life, both professionally and personally?
Yeah, I have been living with episodic migraine for almost 30 years. So since I was just 6 years old, and yeah, and it really impacts every area of my life. I mean, I'm a mom, I have a 7-year-old daughter, and explaining to her that I can't do really normal things like take her to the park or even just get up and make her a snack can be difficult and honestly heartbreaking sometimes. Professionally, if I have to step away with very little notice, my coworkers have to scramble and push deadlines or reschedule meetings, or even take on additional workload in my absence. So it can be really hard to manage.
Yeah. So Dr. O'Brien, what can you tell us then about preventative treatment options for people living with migraines?
Sure. So it's not uncommon where I hear stories like this from my patients that I see every day. And so offering an option like Qulipta, the only oral CGRP once daily prescription medication indicated for the preventive treatment of both episodic and chronic migraine, is important to talk about. In clinical trials, the most common side effects were nausea, constipation, fatigue, and sleepiness. And also tell patients to not take Qulipta if they have an allergy to any of its ingredients, as a severe allergic reaction can occur, and it can occur the same day of taking the medication or days after. Although when you look at the studies, it's been proven safe and in general, and can lessen the number of migraine days that patients have over time.
And doctor, how does it work? How does Qulipta work?
So Qulipta works by blocking CGRP, a molecule that is indicated as one of the causes of migraine.
So interesting. And Kelsey, what has your experience been like with Qulipta?
Yeah, since starting the medication, I do have fewer migraine days. I have less difficulty going through all of my daily activities, so it has really made a huge impact on my life.
That's wonderful. I'm so glad to hear, and maybe this can help some other people out there. So where can we go for more information on all of this?
Absolutely. So patients can talk to their healthcare provider, neurologist, or headache specialist and see whether or not Qulipta may be an option for them. Or they can go to Qulipta.com or call the number 1-855-QULIPTA for more information.
All right, great. Thank you so much, ladies. And Kelsey, I'm glad you're feeling a little bit better. And if you'd like to see this interview again, just head on over to our website as well.